Thank you so much for joining us. I am Sarah Stokes. I am happy to be with you again tonight for a second version on my end of Her Story, Her Heart. And we are going to be sharing some special stories with the folks up on our panel tonight as well. So, just a little background. I am the owner of Queen of the Castle magazine, and our whole mission is to make women's lives better with our stories and telling your stories every single month. So that's why this really fits. We have a wellness section every single month, and we try to just really hit home on the important things, and that's why tonight's information is going to be incredibly important. So I am a wife and a mother to this bunch, Katie and Canyon. They're 3 and 5, and Chris, he's 42, in case you needed to know. Acts like the 3-year-old sometimes, but you didn't hear that from me. So right now you know that we have come off the holiday of all about these hearts. I pulled this off my fridge tonight, and I found out Dr. Calvin has a preschooler with my daughter too. So we know all about this kind of heart, but tonight let's learn about the heart inside. So as the mother of a young daughter, I know that heart health is a legacy, and her heart is so happy right here, and she makes me happy. I have a mom who I need to make sure her heart's healthy, a grandmother, and I'm sure you all do as well. So when we look out at each other, it's probably a safe bet that part of why we're here and why we care about our hearts is because of our loved ones. So the message, don't let I should become I wish I had or I have, is one a lot of us women need to hear. There it is right there. I should not become I wish I would have. Raise your hand if you've ever put off your own exercise because of your to-do list. Thank you. I'm like, I know it, right? Raise your hand if you've ever skipped the veggies because the steak and potatoes are just so much better. I know potatoes are a vegetable, right? But they're a starch, yes. And maybe you skip the fish because it's Packers Day and what's on the grill? Steak or burgers, right? Well, I think for the last 5 years, giving birth to 2 children, giving birth to 2 businesses, I really let everything that I should have been doing go. So I was in top form and had a beautiful baby boy and then a beautiful baby girl, and all I can say about my health is that I've grown a really healthy head of hair since then, and I have not taken care of my heart health. So I'm happy to say that I cannot be a hypocrite tonight. I finally am making the choice to put myself on the calendar. So raise your hand if you're putting yourself first this year and getting exercise, sleep, right? Sleep is so huge, and a wonderful diet. So good. And you can call me out on it on the street if you want and say, Sarah, you cleaning those closets? That's one of my goals, and shedding all this extra weight that is just piled on with all the stress over the years. So as we put our health first tonight, we're focusing on women, but gentlemen, thank you for being here tonight. High five to you. Heart disease does not discriminate, and neither will we. So we are glad to answer all of your questions tonight. We're going to hear from 2 women on the stage who are heart survivors. Please give a wave, ladies. Gail Kleppe of Eau Claire. Can you wave? Thank you, Gail. And Velda Swenson of Eau Claire as well. Velda, give a wave. We cannot thank you enough for being brave to share your stories tonight. And from the Mayo team, we have nurse practitioner Susan Pope. Give a wave, Susan. Cardiologist Dr. Andrew Calvin. And cardiovascular surgeon Dr. Thomas Carmody. So this is pretty informal. We're going to start off with Gail, and she's going to tell her story. Then the medical providers can give us a little bit of an interpretation, and you can ask questions, and then we'll do the same thing with Velda's story. Did anybody read Gail's story in the Leader Telegram? It was a great story. So 2 things that inspired me when I learned about Gail. She was an elementary school principal for 17 years. She has been a long advocate of Happy Hearts, making a heart costume to wear each year on Valentine's Day to pass out Valentines to students. How special. And yeah, isn't that cool? So if you see her around town, you know that's a win. She listened to what her heart was telling her as well and sought help before it was too late. So Gail, if your microphone's on, we can start with your story.
Thank you. First of all, I just want to say thanks for coming this evening. Part of my appreciation for surviving a heart condition and having intervention is to give back and to try to spread the story how important it is to listen to your body. So that brings me to my story. Last March, I turned 65, and to celebrate, I decided I would go for a hike. So I walked 4 miles on a gravel road that led me from a farm in Minnesota where I was with my husband temporarily to back to the state of Iowa. This farm is on State Line Road right between the two states, and I thought, I need to celebrate my life, and I just need to, hike down the road 4 miles and stand in a field and go back to the place of my birth. So I did that. No problems, didn't have to rest, got back home, went out for lunch. Everything was great. Came June, and the second week in June, something wasn't right. And I had 2 things that were troubling me. One was I was a pretty active person, but now, as of that date, that time in June, I was short of breath with any kind of exertion. Even coming up a flight of stairs, I was short of breath, and I had a burning sensation right here in the upper chest area. And I have a chronic sinus problem, and I had sinus infection, and I thought, well, that's probably what's causing it. So I made my trip to Eau Claire to see my ENT doctor and got meds. Nothing changed. And I would go out walking and just checking to see how I was doing, and both those symptoms that were new to me did not change. So I did make an appointment to see my family physician, Dr. Jean Anderson, here at Mayo, and she did an EKG and a chest x-ray, and they looked pretty normal. And she said, but Gail, I'm concerned, and so because of your symptoms, I would like you to have a nuclear stress test. So I saw her the end of July. I had the stress test the second week in August and waited for the results. And I got the call, and the doctor said, this is really suspect for coronary artery disease, and we want to refer you on to cardiology. So I was referred to Dr. Kelvin, and I think it was 10 days later I saw him, and he chatted with me, and he shared information, and he looked at my records, and he said, I think we need to do an angiogram just to see what's going on. And so I did that 3 days later, August 27th, and I went into the procedure not knowing exactly what was going to happen, and I woke up. I heard things during the procedure, but not enough to figure out what was actually going on. And when I woke up, I had 3 stents. And I was told that there was a blockage in an artery to the right side of my heart, and 100%, and to the left side, 80%. So I figure that I am a very lucky person. I am thankful every day for my life, but also that I listened to my body and I took some action. And both Dr. Calvin and Dr. Carmody are excellent, but they can't do anything for anyone unless we come to see them. So my message to you is, please, if you have symptoms, I have chronic pain. I have lots of soft tissue damage because of a car accident. So neck pain, shoulder pain, back pain meant nothing to me. I live with it every day. But those 2 new symptoms really, really were telling me that I needed to get help. So anyway, since then, I went into cardiac rehab 5 days after the procedure, and people there were excellent and gave me lots of support. So I do try to exercise an hour a day, and I'm only human, so sometimes that doesn't happen, but I am trying. And I have to tell you that my husband, Bo, was diagnosed with coronary artery disease over 12 years ago. And so, thanks to Sue, his nurse practitioner, we were trying to eat very healthy, and we read labels, and we were on what we thought was a very heart-healthy diet. So we're continuing to do that. And as I say, sometimes stress gets to me, and that's probably one of the hardest things I have to deal with is controlling stress, because I am in that generation where I'm also helping to care for some elderly parents and in Iowa. So, I'm back and forth. So that's the big thing for me is controlling stress. But exercising, eating healthy, getting rest, and taking care of myself is very important.
It says responses are not a substitute for medical advice, so please consult with your own personal health care provider for your individual care and questions. So, risk factors. Gail talked about risk factors. She noticed them. She took action. Sue, can you talk about some of the risk factors?
Okay, you have the next slide up. Good. Most of the risk factors that lead to heart disease are common to men and women. Gail probably is a good example of someone that didn't have a lot of risk factors. Am I right on that, Gail? So, the more risk factors you have, the more likely you are to develop coronary disease. But on the other hand, just a lack of risk factors or having one or two main risk factors is something to pay attention to as well. So they're listed up here as those that are similar for men and women. There are a couple that are more specific to women, but most of the risk factors we share. The first one is high cholesterol, and your first slide where you voted on whether HDL or LDL was the good fat or the bad fat, those are important things to know. Just your total cholesterol isn't really adequate. It's a starting point, but we want to know what the breakdown is, and in some people we look at even more genetic factors than just the HDL and the LDL. So cholesterol is important, and treating cholesterol in the right people that are at higher risk is important as well. High blood pressure, we shoot for at least under 140/90. And again, your provider, your healthcare provider will help you determine when it's time to go beyond the lifestyle changes that help with high blood pressure and cholesterol, and when we go into medications for both of those as well. Obesity, smoking, of course, is a very important risk factor. The next one, and genetics, I guess I can't emphasize that enough. Those of you that have a family history of early heart disease, even if you don't have a lot of other risk factors, that's a very important one to pay attention to. It's obviously one we can't do much about, but we can do a fair amount about the others if we're aware of that. The metabolic syndrome, some of you may not be as aware of that. That's kind of a precursor to diabetes. And actually, diabetes isn't up there. It should be up there. It is also a risk factor for heart disease. But the new guidelines that came out not too long ago gave us some kind of good news about that, in that we used to consider diabetes a risk equivalent to heart disease. So we used to say, if you have diabetes, you're at as high a risk as someone that already has heart disease. We really don't say that anymore. And if you have diabetes that's well controlled and don't have much in the way of other risk factors, that's a really good thing. It's still something we pay attention to, but controlling your diabetes is very helpful. Metabolic syndrome is a combination of factors that put you at higher risk for developing diabetes. Abdominal obesity, hypertension, high triglycerides. Those are all the factors that play into what we call metabolic syndrome. And again, the more of those factors you have, the more likely you are to develop diabetes. So those are the risk factors for heart disease that we share. Women, after they go through menopause and lose their estrogen, their risk for heart disease does go up. That's why the incidence of heart disease in women after menopause also goes up. That doesn't mean that premenopausal women can't have heart problems, but the risk does go up afterwards. And stress, anxiety, depression are factors that tend to play a little bit more in women as well. Okay, let's go on to the next slide in terms of symptoms, and I'll just go through these briefly. Dr. Calvin may want to add something to this as well. We talk about the difference in symptoms in men and in women, and often women do have different symptoms, but Gail obviously had very traditional mid-sternal burning with exertion, and she was short of breath. Now, there are those that you might take the burning sensation away, and just the shortness of breath is a symptom of developing heart problems. But I've had women in my office. I remember one a few years ago that had been to the dentist several times because she was having jaw pain, and he very accurately sent her elsewhere for help because he realized that hers was not a tooth problem. So it can be jaw pain. It can be in the central part of the chest, but it can be just in the arms. Sometimes, a lot of times, women or men come in with epigastric pain, which is pain right down in this area, and what might you think that is if that happens? Heartburn. We often hear, I've developed heartburn, and it happens when I exercise. Well, that's a concern if that's what's happening. Fatigue is another kind of difficult syndrome or symptom to work through, because how many of us have busy lives and are more fatigued at times than others? But if it's something that you're noticing becoming more and more of a problem, and you just can't feel like you can get enough sleep, you're tired all the time, that is something to pay attention to, even without the other symptoms. Okay. Do you have anything to add? Okay.
All right. Thank you, Sue. And we do have a slide that Dr. Calvin is going to show us that really animates angioplasty and stents. Doctor, when that gets going, can you walk us through that?
Yeah, absolutely. So what this shows is the heart, and the big red thing coming off of it is the aorta. That's the major artery that comes off of the heart. This shows in the heart arteries itself a blood vessel that's plugged with plaque. This shows us a catheter that we cross the plaque with. We inflate a balloon to smush the plaque out of the way. We can then put in a stent, which is like a metal scaffold to hold that area open. And this has really revolutionized the treatment of heart disease in a lot of ways. The good news is we can treat those plaques and restore blood flow to areas of the heart that we couldn't before. But at the same time, that treats one little area of the heart. These stents are only about an inch long or less. The rest of the artery is still at risk, and that's where diet, exercise, medications, cardiac rehab all come into play. So as you see, this is the procedure that Gail had, and this is something that we do here on a daily basis.
All right, let's talk with Velda now about her heart journey and what brought her here today, and then again we can open it up for questions. Miss Velda, are you ready?
I'm ready.
All right, go for it.
Well, my story is entirely different. All my life I had a heart murmur from the time I was, I don't know how old. I've never had any pain, but as I got older, I've always been active. I've been a walker. By the way, I'm 91 years old. So, I've always been a walker. I've always been active. But through the last years or so, my asthma seemed to kick up. So I was treating that, and I keep on walking. Well, I went in for a checkup, and they'd been watching my heart valve because it was closing off. Well, the last time I went in, I had an opening about the size of a lead pencil. Never had a pain, just short of breath, always short of breath. So they said, you're going to have something done. I wanted to wait until they got the heart unit here at Luther, the new unit where they could do surgery. They said, no, you can't wait that long. So I had to go to Rochester. Well, that was quite an experience. I got there on a Wednesday. I got there Wednesday morning, and I had surgery. I came home Friday, if you could believe it. I had the new surgery. It's called yeah. And all I had was 2 openings in my thigh or groin. No pain. I never had a pain pill. It was like a walk in the park.
Wow.
And I came out of the surgery, and I wasn't short-winded. I've not had an asthma attack since. I seem to believe that maybe it was my heart instead of the asthma that I was treating for years. And one reason I think they put that off so long, I have unusually high good cholesterol. So they just let me float along, just do what you want to do. I would recommend this kind of surgery to anyone. There was just nothing to it. In fact, my family, who are so thoughtful, forgot to keep track how long I was in the operating room. No one knows how long it took. So I feel great. I exercise. I did go for the rehab or the exercise down at Luther Hospital, but I've always been a walker, so exercise. And we live in a 2-story house. I would recommend that one to anyone. So don't be afraid. That's of going in and checking, and don't be afraid of the surgery because they certainly know what they're doing.
Thank you, Velda. I think you're officially my hero now. You are, wow. And too bad Mayo doesn't have like a video camera here to get you on for a commercial for them, because that was a rave review. So let's turn it now to Dr. Carmody. We have a slide with an animation showing the TAVR surgery that she was talking about. Doctor, can you walk us through this slide and explain how it works?
Sure. You see the heart in the middle and the major vessel coming out of the aorta, and it splits in the pelvis to 2 big vessels that then split down into the leg. We go into that leg with a catheter. We start with a wire, and we will place that wire initially into one of the cusps of the aorta that gives us a marker, and we bring up another that goes through the valve itself. And this is one of roughly 4 or 5 approaches we can do for this particular event. And we feed it through the heart, and once we go through the valve, we then bring it out in the measured valve, and we deploy it. And as Velda said, actually the surgery itself is the tip of the iceberg. It's a big process of, you went through a lot of tests to get to that point. You went through a lot of discussions and a lot of measurements. And we have a lot of people in the room. And the buildup is very, very, very big. And the surgery takes us about 15 to 20 minutes to do it.
Wow.
And so yeah, once you get into the surgery, you're not in there very long. And then the great thing about it is, as you can see, the heart is beating in the cartoon animation. We don't use the heart-lung machine. We're working inside the heart. And back in the 50s, we were trying to figure out how to get inside the heart. We could fix things outside it, and we had to come up with a big fancy heart-lung machine, which we still use today. This isn't for everybody, but Dr. Alain Cribier in France came out with it in 2002, rudimentary form. It's progressed, and we had to start with very, very high-risk, unoperable patients. We risk stratify them based on their medical history, what they bring to the table. We proved it in Europe. It came over to the United States, and that particular group of patients did very, very well in a 1-year mortality. We then extended it down to our high-risk patients based on an STS stratifying score, and they as well are doing very, very well. They get out of the hospital very quick. They're back on the lawnmower in a week, and they're back in the saddle. It's wonderful. So technology has really brought this a long way. We've already extended it, and we're working on the mitral valve right now. I think in 10 years it'll be down into the lower risk category. There's still small things. There's a risk of permanent pacemaker is a little higher risk with this particular procedure. Perivalvular leak tends to be there a little bit. We're on our early generation of valves that we're using, but it's extremely exciting, and it's only going to get better and better.
How cool. Well, Dr. Carmody, can you talk about the importance of cardiac rehab? So after surgery, why is this so key?
Well, anytime we work on the core of the body, that would be your chest or abdomen, different than working on legs, arms, and neck, it really zaps the patient. And just this particular procedure, although it was probably quick for you, you probably felt a little, down and out for a little bit. And they'll go home and they as you mentioned earlier, how many people pick something else to do than exercise? There's always an excuse not to do it. So after we have any kind of surgical procedure, whether it's open or closed such as this, or even stents and so forth, it really zaps you a little bit. You're tired. Your heart's happy, but the body's zapped. And so if we leave it up to you to just sit there and get down on your treadmill or whatnot, you'll find 1,000 other things you can do. So we set up a rehab program to make you get into the gym, physical therapy, see them 2-3 times a week. We get your report card, we see that you're going and all that good stuff and check it off. And then, usually within weeks of the surgery, you're back in the saddle and you don't need it anymore.
So Velda got her... Oh,
still need the exercise.
Still need the exercise. Amen. So Velda, now you know how long your surgery was. You're good. Was that underwhelming for you? Were you hoping it was a really cool number? You've got enough to brag about, but that is neat. So what other questions do we have for the panel? Yeah, right? Oh, we're going to wait for our microphone to find you. Here she comes. Wait. Oh, go for it. Yes.
Does having a hole in your heart have anything to do with a heart attack?
Not directly, but maybe indirectly. Dr. Calvin works a lot of that up and then hands them off to us when he feels it is a necessary issue to address. But it can make your heart work a lot harder. It can make it inefficient. Not supposed to have holes in your heart, so you get blood going in the wrong direction, and over time, it'll tax the heart. And we like to follow that type of stuff, certainly, and based on where that hole is, maybe get after it very sooner than later. Does it make a heart attack itself? Probably not, but it makes the heart unhealthy in other ways. But you're accurate. That's good. The name of the procedure is transaortic valve replacement, otherwise known as TAVR, TAVR. If you read up this in Google, you'd see TAVI, transaortic valve insertion, because that's really what we're doing. We're not replacing your valve. You remember the animation that Dr. Calvin showed you of the plaque in the vessel and how they went in there with a balloon and squished it to the side? It's exactly what we're doing with the valve, except that stent that he showed you in there. Instead, the stent is just like what we use for TAVR, but there's a valve inside that stent, sutured right to the stent. So we squish the hard plaque aside, and in there is a functioning valve. Your valve is still there, just squished to the side, and it's called TAVR. Your second part of your question was, is there a way of us removing it? For the coronaries or for the valve?
Any place in my body where I've got plaque built up.
Yeah, that's tough.
It out before we have to go through this stuff.
Yeah.
Well,
on your own.
You can stabilize it. We can't remove it like liquid plumber. That would be awesome. Take a pill and just wash out the pipes. But they're working on that. High density lipoprotein in NHI. But will we see it anytime soon? I don't know. But we can stabilize it on those statin drugs we're taking. We don't want them to break off and go away. Certainly, you can keep it from progressing by changing lifestyle, changing your diet. Shrinking it is asking a lot, but stabilizing it's huge, and keeping it from growing any bigger is huge. In the open technique, we clean that old valve out. When this first came out in 2002, actually it was 2004 when he presented it at our Society of Thoracic Surgery down in Tampa, and we all thought he was crazy when he about squishing this plaque aside, and your brain's just north of there. So we were questioning that. But it's the technology. The industry got involved. They've come up with some great accessories to come along to protect you, the patient. But cleaning it out, we do it directly. In the coronaries, there are some rotor-rooting they'll do, but that's the last kind of things that they don't look forward to doing in the coronaries. We just push it aside.
So, doctor, is there anything that you can do at home to shrink it besides obviously stopping that unhealthy lifestyle? I mean, there's folklore, like, is it onions? And you know what I mean? There's folklore things. Is there any truth to anything like that?
So there's two parts to the question. First of all, is there anything you can do to prevent your aortic valve from going bad over time? And as far as we can tell right now, the answer is no. We've tried a few different things. It hasn't seemed to work. The only thing I know of is don't get older. And Velda says that's what she's doing, so she's following the advice. So, and then, as you heard earlier, whether we can shrink plaque that already exists is a little bit contentious. There are a few studies that suggest that maybe it's possible. That's typically only in people who take extremely high-dose cholesterol medications, they exercise a lot, and their diet is perfect. For the vast majority of people, simply stabilizing the plaque is all that is needed. And if we can do that, usually the person can do very well for decades and decades.
Well, we have given ourselves the gift of time tonight, and we want you all to take time each day to make sure that you're doing these 6 things that can keep you off the operating table, right? So don't use tobacco. Use alcohol in moderation. Exercise 30 minutes most days. Eat heart-healthy diet food. So eat a heart-healthy diet. Low in cholesterol, fat, and salt. Maintain a healthy weight. Get regular health screenings like your blood pressure for diabetes and cholesterol. Can we agree we're going to do these? Does that sound good? Now we need to take these tips to heart too. So if someone you love was not here tonight who could benefit from this information, take your smarty pants self to their door tonight and tell them all about it, or send them a text, right?